I would say the most common symptoms we see are either excessive drainage, throat clearing, postnasal drainage, or facial pain and headaches. Those are pretty much the main symptoms that patients have. After those two, the drainage and the headaches, I would say snoring or obstructed breathing through your nose. Probably the rarest, or not rare, but the most unusual symptom that people don't connect is chronic fatigue. People that have chronic fatigue often have sinusitis. They're not aware that that fatigue is being caused by the body using energy to battle off the chronic infection in their sinus. A lot of people that come in, once the procedure is done, come back saying, oh, I feel so much better, I am so much more energetic, etc., etc. So that's kind of an odd symptom, although it's the most common symptom of chronic sinusitis. Another symptom that people don't connect oftentimes is ear symptoms, ear pressure, dizziness, problems flying, problems diving. And that's because the drainage tube of the ear lies behind the nose. And if the drainage tube of the ear is obstructed, the eardrum becomes pressurized, and that produces the symptoms of ringing, dizziness, pain, ear discomfort, etc. So another symptom that people don't often associate with sinusitis is the ear symptomatology. I think the biggest problem with the healthcare system, the way we have it set up right this at the moment, is that patients are under the impression they have to go directly to their primary care doctors, driven by the misconception that if you have private insurance, for some reason they think you have to go to a primary care doctor to get referred. The problem with the primary care doctor in treating these types of symptoms is that they're good at a lot of things, but they're not great at anything because they're not specialists in those situations. And that's why we've gone to the general public with our advertising campaigns to get the patients to come directly to the ENT. So we have a whole spectrum of things different than the primary care doctors. And that's why oftentimes we see patients very frustrated, years on antibiotics, steroid injections, etc. They sometimes think the steroid injection is an allergy shot. There's a lot of confusion going on. Those physicians don't have all the alternative therapies that are available for the patient.